The Center for Disease Control reports that diarrheal diseases account for 1 in 9 child deaths worldwide, making diarrhea the second leading cause of death among children under the age of 5. Rotavirus is the leading cause of acute diarrhea that causes about 40% of hospitalizations for diarrhea. Despite the global introduction of vaccinations for rotavirus over a decade ago, rotavirus infections continue to contribute to diarrhea-related deaths, which result in more deaths than AIDS, malaria, and measles combined. During the Rotavirus Accelerated Vaccine Introduction Network, or RAVIN, there were 4 types of rotavirus vaccines available for international use: Rotacil, Rotavac, Rotatec, and Rotarix. Rotarix was in use in many countries. However, in early 2018, the manufacturer of this vaccine announced a global shortage in supply and therefore could not satisfy demands for this vaccine from countries that have not yet introduced it. This resulted in countries reconsidering their rotavirus vaccine product choice and timelines, and also delayed the introduction process in several countries in which RAVIN was providing technical support with the Ministry of Health, an expanded program on immunization, and partners. When it comes to selecting the right vaccine for their communities, country decision makers must weigh their options based on country needs that include disease burden and epidemiology, cost and financing, immunization system functionality and delivery, and access to vaccines. Each vaccine has specific characteristics that country leaders must consider in their selection. These characteristics include the presentation type, such as if the vaccine is in liquid form or freeze-dried, the price per dose, the doses needed to fully immunize each person, wastage rate, vaccine administration, shelf life, and cold chain requirements to keep the vaccine safe and potent. The country must also be able to introduce the vaccine efficiently and equitably, particularly with the most at-risk populations. RAVIN was created to increase focus on rotavirus vaccination with global and regional partners and provide support to 8 focus countries: Afghanistan, Bangladesh, Benin, Cambodia, Democratic Republic of the Congo, Laos PDR, Myanmar, and Nepal, with the rotavirus vaccine selection and introduction. RAVIN complemented the efforts of the Ministries of Health and key partners in each country to facilitate the decision, planning, and introduction processes for the rotavirus vaccine introduction. This included supporting the countries in developing their vaccine introduction grants to Gavi. RAVIN also helped to build in-country technical knowledge and address cold chain needs to prepare the country for the vaccine rollout, strengthen in-country community networks, and with communication outreach to communities to increase awareness. Partner integration was also an avenue for a multifaceted approach with water, sanitation, and hygiene, with rotavirus vaccination fitting nicely into WASH initiatives, given the correlation with protecting children from diarrhea-related illnesses. As a result of these efforts, RAVIN successfully facilitated the introduction of rotavirus vaccine in 4 countries: DRC, Benin, Nepal, and Afghanistan. These countries have integrated rotavirus vaccination into their routine immunization programs, ultimately diminishing childhood deaths from another preventable disease.